We've been talking quite a bit in recent days about a new concern for parents in this COVID-19 pandemic. Some children are showing symptoms of a new illness: inflamed red skin, swollen hands and feet, redness in the eyes. We've been talking about its similarities to Kawasaki disease and toxic shock syndrome. It's been linked to the deaths of 3 people, young people in New York, and there are mounting concerns about it in Canada as well, and indeed around the world. There's an international study to learn more about it and its potential connections to COVID-19. Leading that global study is a Canadian, Dr. Freedman, who is a pediatric emergency medicine doctor at Alberta Children's Hospital. He's in Calgary up early for us and with us this morning. And Dr. Freedman, welcome to our program.
Good morning, Heather.
I know you're speaking to me and to us just after having spoken to people at the World Health Organization about this very issue. Anything of interest and of import to come from that conversation, Dr. Freedman?
Well, it's great to see experts from around the world, and particularly places where they've been seeing more cases for longer. These cases started to appear over in Europe, in Italy, Spain, followed by the United Kingdom, before we started to see reports out of the United States. So working as a group, we're collectively really trying to come up with a working case definition. So trying to define this syndrome that we're calling pediatric inflammatory multisystem syndrome at the moment is a working name, and trying to really figure out how it is, or is it related to COVID-19, and what the features of it are, so that we can start to recognize it and share that information.
Can we just pause on the new name, because we've been saying something similar to Kawasaki, but you're trying to distinguish, aren't you, to make sure that it's because you don't think it is Kawasaki itself. So pediatric inflammatory multisystem syndrome, I guess, indicating what it appears to attack.
Exactly, that's what it appears to cause, and we think it is separate at the moment from Kawasaki syndrome, in that the children are a little bit different than what we would typically see with Kawasaki syndrome. In this case, the children are a bit older, and they tend to have more cardiac dysfunction. They tend to have low blood pressure and require intensive care unit admission, which is a bit unusual for Kawasaki syndrome. So at the moment, the collection of data is really crucial, so we can start to see, is it the same, is it different, and what are the etiologies? Even Kawasaki syndrome, we don't entirely know exactly what triggers it, even though it's been around for decades now.
And as you embark on this international study, what is the best thinking now in terms of potential ties to COVID-19 specifically?
Well, it does appear in the larger case series that are primarily coming out of Europe, out of the UK at the moment, where we have data, that approximately 2/3 of the children either have evidence of SARS-CoV-2, so the virus causing COVID-19, on a swab, or their antibody tests are positive. But once again, that's about 2/3 of the kids, which is not all, but it is quite higher than one would expect to see in the general population, even in these countries where there's been a high prevalence of infection.
So as you embark on this international study, and just so everybody understands, you're leading a study that's going to look at more than 50 sites in 14 countries and collect data from thousands of children. More than 10,000 is the goal here. And what specifically will you be hoping to identify and to learn?
Yeah, so this study is funded by the Canadian Institute for Health Research. It wasn't designed, it was actually funded even before we had even started to hear about this syndrome. So it was designed to look, though, at predictors of severe disease or adverse outcome in children, and capturing both kids who are COVID-19 positive, essentially, on the test, as well as those who are negative. And so what we're hoping to do as it relates to this syndrome is capture uncommon entities like this inflammatory syndrome, and then try to connect it and connect the dots to the infectious etiologies that we're finding in 57 sites at 14 countries around the globe. So particularly, Canada has been quite well. We haven't seen a lot of disease in children, thankfully, to date, whether it be even mild and definitely not very many severe cases. So we're hoping to learn from these other countries where the disease has been more prevalent, so that we can be informed, because as we're increasingly hearing, it is not going away anytime soon.
No, and as you mentioned, it's international in scope. There have been deaths recently reported in New York, and although the number of Canadian cases is low, we are focusing on 15 to 20 children in Quebec, which have caught national attention, I know. So I'm thinking of Canadian parents who are listening to our conversation quite terrified at the prospect of all of this. What should we know from the Canadian perspective? Is there context or reassurance that you can offer?
Definitely can. So first of all, children represent about 4 to 5% of all positive test cases in Canada. So primarily not a disease of children. The other piece is that even when infected, very few children actually require hospitalization. And the other piece is even these cases that have cropped up in Quebec, which has been our hardest hit spot so far in Canada, we still don't actually know, are these children more typical Kawasaki syndrome? Are they another infectious etiology, or are they more related to COVID-19? So I think really from a general perspective, the vast majority of children who are infected do very well. And this really doesn't change that story. These are small numbers of cases, obviously concerning when there's an entity we don't entirely know of, but the vast majority of children do very well still. And I think if there's any concerns, the provincial telephone health advice lines, the family doctors, pediatricians, and emergency departments are well set up to handle these cases.
It's really interesting to listen to you say that, because that was going to be my concluding question, in that we've talked throughout this disease about how children, it appears, are not particularly affected or tend to have mild disease, and question about how readily they transmit this. So what you're looking at now, you're saying, doesn't necessarily change that perception, but perhaps, am I getting this right, makes you want to question it further. Is that fair?
I think the overall perception is the vast majority, and it doesn't change. The vast majority do very, very well, even if they do become symptomatic. I think it's important to know about this as physicians and clinicians, because we need to be aware of it. And the other interesting piece is that it tends to present several weeks after often a COVID infection. So it's often delayed about 3 to 4 weeks following the peak of COVID-19 in a region is when the cases start to appear. So I think it's more about alerting physicians to be astute and be aware that some children do become very sick, which is no different than any other children. And probably one of the important take-home points is parents should not be afraid to bring their children to emergency departments across our country. They're very well prepared and really well equipped to manage children when emergency care is needed.
Okay. Dr. Freedman, I'll leave it at that, but we'll be in touch, because interesting research lies ahead of you, and we're certainly interested in your findings. Thank you very much.
Thank you, and have a good day.
You too. That's pediatric emergency medicine doctor in Calgary, Dr. Stephen Freedman.